Mental health illness PSA, borderline personality disorder. BPD is a serious, long-lasting, and complex mental health problem. It can impact the way you understand yourself, the way you react to the world around you, the way you cope with emotions, and the way you navigate relationships. People with BPD have difficulty regulating or handling their emotions, difficulty controlling their impulses, highly sensitive to what is going on around them, react with intense emotions to small changes in their environment. Demographics and prevalence. About 6 to 9% of the population has a personality disorder. 78% of patients are among young adults between 15 and 44 years of age. Social misconceptions. BPD is more prevalent in women rather than men. There were previous studies showing that women were diagnosed at a rate of 3 to 1. There were plenty community observations for BPD conducted that showed no significant difference among genders. This misconception can be linked to clinical bias or women being more willing to seek medical care than men. These misconceptions can possibly lead to more men being hesitant to seek medical help. These misconceptions can be eradicated with proper and more thorough education and awareness. Causes. In the broad category of mental health illnesses, much is still not understood about them. This includes BPD. Factors in an environment, especially in a young child's home environment, such as mental or physical abuse or even neglect, can cause BPD. Studies show that this illness can be linked to genetics. This means that a family's history and other mental illnesses can be a marker for BPD. Changes or irregularities in parts of the brain that are involved in aggression, impulsivity, and emotion regulation has been shown to be a factor in the development of BPD. Neurochemicals like serotonin may also not function as they should, resulting in BPD. BPD may also be caused in part by being exposed to invalidating, traumatic, or unstable relationships. Also, conflicts that are hostile in nature. These factors extend not only to environments but to culture and society as well. There will be people without some or all these risk factors that will still develop BPD during their lifetime. Onset of BPD. The effects of BPD usually begin to show or occur during a person's adolescence and early 20s, although the onset may happen in adults over the age of 30. Some behavioral factors or clues are present in some children at a very young age. At the age of 17, 60% of people with BPD have self-harmed. Symptoms. Borderline personality disorder can affect your behavior, how you feel about yourself and others. There are mood swings, suicidal threats, intense anger, binge eating, drug abuse, and rapid changes in self-identity and self-image. These are all signs and symptoms. Daily life effects. Borderline personality disorder can have a major impact on your health and day-to-day life. It can impact your relationships between friends, coworkers, loved ones, and higher authorities. Living with BPD poses some challenges such as emotional pain and feelings, desperation, anger, and hopelessness. It can also lead to you being absent for a while from school and work. It can interfere with your success. Healthy self-care can help reduce emotional pain. Exercising, eating healthy, positive thinking, getting enough sleep can all help with relaxation and stress reduction, resulting in lesser effects. Treatments for borderline personality disorder. It is commonly treated with psychotherapy, but medication can also be given as an aid. The goals of psychotherapy are to help the patient to focus on current ability to function, learn to manage emotions that feel uncomfortable, reduce impulsiveness by helping you to observe feelings rather than acting on them, learning about BPD, and working on improving relationships by being aware of your feelings and those of the people around you. There are many different types of psychotherapy that can be deemed effective. Dialectic behavioral therapy, also known as DBT, includes group and individual therapy designed specifically to treat borderline personality disorder. DBT uses a skills-based approach to teach you how to manage your emotions, tolerate distress, and improve relationships. Schema-focused therapy. This therapy can be done individually or in a group. It can help identify unmet needs that have led to negative life patterns, which at some time may have been helpful for survival, but as an adult are hurtful in many areas of your life. Therapy focuses on helping you get your needs met in a healthy manner to promote positive life patterns. Mentalization-based therapy, also known as MBT, is a type of talk therapy that helps you identify your own thoughts and feelings at any given moment and create an alternative perspective on the situation. MBT emphasizes thinking before reacting. Systems training for emotional predictability and problem solving, or STEPS, is a 20-week treatment that involves working in groups that incorporate your family members, caregivers, friends, or significant others into treatment. STEPS is used in addition with other types of psychotherapy. Transference-focused psychotherapy, also known as TFT, also called psychodynamic therapy, TFP, aims to help you understand your emotions and interpersonal difficulties through the developing relationship between you and your therapist. You then apply these insights to ongoing situations. Good psychiatric management. This treatment approach relies on case management, anchoring treatment, and an expectation of work or school participation. It focuses on making sense of emotionally difficult moments by considering the interpersonal context for feelings. It may integrate medications, groups, family education, or individual therapy. There are no specific drugs approved for the treatment of DBT. BPD, but medications like antidepressants, antipsychotics, or mood-stabilizing medications can help with symptoms of depression, anxiety, aggression, and impulsiveness. Community resources. There are many community resources for people suffering from borderline personality disorder. BC Partners for Mental Health and Addictions Information. 7 agencies came together in order to create this project. It helps you find quality information, learn new skills, and connect with many resources. It helps you explore many strategies in order to help you take care of your mental health and control substance abuse. You can find information regarding mental health and substance abuse problems and how to manage it. Connex Ontario. This is a bilingual information and reference service for the public and professionals in Ontario. It is for people who would like to have access to addiction and mental health treatment for themselves, their family, members, friends, or clients. Connex Ontario operates on its own website provided above and the toll-free numbers listed below. There's a Drug and Alcohol Registry of Treatment, the Mental Health Service Ontario, Information Ontario, and Ontario Problem Gambling Helpline. The numbers and websites are listed below. Here are some internet resources provided below as well. Centre for Addiction and Mental Health, Canadian Mental Health Association, BPD Central, so the Borderline Personality Disorder Information and Support, Borderline Personality Disorder Resource Center, and the National Education Alliance for Borderline Personality Disorder. Discussions and questions. Number 1. If someone with BPD commits a serious crime, what is the right way for society to respond? I will now give a minute for discussion. Alright, number 2. How do you encourage someone with BPD to seek help? Please discuss. Number 3, what do you think is the best way for a family member to support a member with BPD, especially a young family member? Please discuss. And lastly, what previous things did you think were true about BPD that you found out were incorrect? So, what misconceptions did you have that you now know are not true? Please discuss. Alright, and here are our reference pages. And one more social misconception and PSA. So, many people believe that BPD does not occur in people younger than 18, that it can't. However, no version of the DSM, so the Diagnostic and Statistic Manual of Mental Disorders, has ever prohibited the diagnoses of people younger than 18. Mental illness does not discriminate, and the sooner treatment starts, the better. And PSA, 1 in 5 adults live with mental health conditions. Or condition. There are lots of stigmas that people face, but we can help with empathy and knowledge, and the way that we understand and perceive these mental illnesses. So the words that we use and the understanding that we have matters when it comes to mental health and its illnesses. Thank you, and I hope you all have wonderful days.